This action is called elbow flexion. This action is called wrist flexion. Wrist is flexed by wrist flexors. Wrist flexor means nothing, but it is a muscle group that is responsible for wrist flexion. Myself Sukumar, I am the student of occupational therapy. Our wrist flexors are commonly originated in one part, medial epicondyle of the humerus. If we repetitively do the wrist flexion, it may lead to form the inflammation in the medial epicondyle region. There is no inflammation in the medial epicondyle, that is bony region. There is the inflammation in the tendons of the medial epicondyle. It is also known as golfer elbow. In golfer elbow, same wrist flexors are repetitively active. Remember golfer game. In golfer game, we do these like movements repetitively. So it increases the valgus stress. Valgus stress is the force applied to a joint. That force moves the distal part of the joint away from the midline. Simply you can remember valgus as L. So L means away from the midline. L is going away. So this is L. This is proximal part. This is distal part. So distal part is going away from the midline. This also L. So mirror image of the L. So to reduce the confusion between the varum and the valgus, we remember this L. Okay, what are all the causes for increasing the valgus stress? In throwing sports, racket sports, forceful occupational movements such as construction, plumbing and carpentry. Some persons may develop medial epicondylitis due to degenerative diseases. If the person has medial epicondylitis, the person may feel pain in several movements. First, pronation of forearm. With the minimal resistance, we give small resistance and ask the patient to do the pronation. The patient can't be able to do the pronation. The person also feels pain on wrist flexion and ulnar deviation. What are all the symptoms faced by the medial epicondylitis person? So the person may feel the pain in medial elbow joint. Some persons may feel tenderness, means small shaking of muscles in this area. Some persons may feel spasm of the muscles, stiffness of the muscle over this area. Some persons may feel numbness and tingling sensation from this area to this ring finger and little finger area. Who are all having risk in getting the medial epicondylitis? The age above 30 person have the high risk for getting medial epicondylitis. The person who repeatedly doing the wrist flexion for at least 2 hours per day maybe have the high risk for getting the medial epicondylitis. Obesity, smoking also have the high risk for getting medial epicondylitis. How we diagnose the medial epicondylitis? We can take X-ray or MRI scan and by evaluation of the pain. So pain during the wrist flexion and ulnar deviation are all evaluated. What are all the treatment given to the person with medial epicondylitis? We give analgesics. Analgesics reduce the pain. Analgesics may be given as a tablets or in ointment form. Splint and braces are more useful for medial epicondylitis persons. The medial flexor groups are needed more rest. We have to don't produce any stress, valgal stress or varum stress in this region. If we overuse wrist flexors, we may get medial epicondylitis. If we use wrist extensor, we may get lateral epicondylitis. Remember, tennis players are using these movements frequently. In our next video, we discuss tennis elbow. Okay, thanks for watching our video. I need your support. Please subscribe. Tata.